The topic is Neisseria gonorrhoeae. So the genus Neisseria is the one that is able to cause infection in the human. The two pathogenic group of organisms are Neisseria meningitis and Neisseria gonorrhoeae. Apart from this Neisseria pathogenic group, we also have certain Neisseria species that are that are the normal flora of the human respiratory tract. So the topic that we'll be dealing is about Neisseria gonorrhoeae. So gonorrhea, the gonococcal disease is a venereal disease which is usually transmitted by sexual or sexually transmitted disease. It was first described in the gonorrheal pus by Neisser, and he was the one who was able to identify this organism in the gonorrheal pus and gave the name as Neisseria. And it was cultivated, and the pathogenicity of the organism was given to us by a scientist called as Bum. And the organism is very much similar to that of the meningococci in its structure and in biochemical and cultural characteristics. Coming to the morphology of the organism, it is also diplococci occurring in pairs where the adjacent sides are concave in nature, appearing kidney shaped. So you can distinguish between the Neisseria gonorrhoeae and Neisseria meningitis is they have a flattened surface, whereas these organisms have a concave surface appearing in the shape of a kidney. And mostly these organisms are present intracellularly inside the polymorph, that is the leukocyte. So a leukocyte can contain hundreds of these Neisseria gonorrhoeae organisms. And the organism important characteristic is that it has a pili that helps in adhesion of the organism to the human host and escape the phagocytosis and is able to cause infection. That is the virulent characteristics of this organism, that is Neisseria gonorrhoeae. The pili is very important to cause the infection in the human host. So pilated gonococci are able to agglutinate the human RBCs, but they cannot agglutinate the other RBCs. And the hemagglutination inhibition cannot be done with the help of mannose. Coming to the cultural characteristics, these organisms are very difficult to grow on a media when compared to Neisseria meningitis. They are strictly aerobic and can sometimes grow in anaerobic condition, whereas Neisseria meningitis is a strict aerobic organism, and the pH at which these organisms grows is around 7.2 to 7.6, and the temperature at 35 degrees to 36 degrees centigrade. The growth can be enhanced in a media by addition of 5 to 10% carbon dioxide. The media that is used for the growth of this organism is an enriched media again consisting of chocolate agar and Muller-Hilton agar. And the selective media for the growth of this organism is a Thayer-Martin medium. Colonies on a solid media can be seen in the form of a small, round, translucent, convex or slightly ambulated and a fine granular complex with a lobate margin. Whereas a Neisseria meningitis has an entire margin, this organism shows a lobate margin. And the colonies are of four types, T1, T2, T3 and T4. So these organisms are colonies. Based on the colonies, you can identify to which type they usually belongs. The type 1 and type 2 show small brown colonies. They are pilated, auto-agglutinable, and they are virulent in nature. Whereas T3 and T4 are larger, granular and non-pigmented. They can be easily emulsified and they show smooth suspension and they are avirulent in nature. The fresh isolated from the lesions are usually the one that belongs to T1 and T2 because they are virulent in nature. But on serial subculture, they can change to T3 and T4. So based on this virulent characteristic, these organisms were named as the colonies of T1 and 2 were named as P+, whereas the one which are avirulent, that is T3 and T4, they were designated as P-. Coming to the biochemical reaction, they share similar biochemical characteristic with the Neisseria meningitis, where they are catalase oxidase positive, and the only difference is that they can only acidify glucose but not mannose. And coming to the antigenic property that is mostly involved in the virulence and the pathogenesis, the antigen is a heterogeneous type of antigen. It keeps on changing both in vitro and in vivo. In vivo condition, it helps the organism to escape the human immune response and cause the disease. So it has ability to change its characteristics. So there are different antigenic characteristics that are related to this microorganism. The most prominent or the most important being the pili. Pili is a long, thin fibrillar structure that helps in the adhesion of the organism to the human host. And because of this pili, it is able to escape the phagocytosis and cause disease in the human host. The pili are usually made up of repeated subunits of protein which are called as pilins, and they show antigenic and phase variation. Because of this characteristic, it is able to change its morphology and the structure, and is able to cause infection in the human host. So they have antigenic and phase variations where they have both constant and variable regions present on the pili, and able to cause the infection in different host and able to escape the human immune system. Coming to the another important type of antigenic characters expressed by this organism, it is a trilaminar outer membrane protein. This in turn contains other different types of protein. The first protein is a protein 1 that shows antigenic diversity, and this particular property helps in typing of the organism. So based upon this protein, you are able to type the different groups of Neisseria gonorrhoeae, and a single strain will contain a constant type of protein, whereas the different strain will contain different types of protein. So based on these characters, we can group the Neisseria gonorrhoeae organism, and there are variants of this protein. They are called as IA and IB. A strain can contain either IA or IB, but not both. And with the help of the monoclonal antibodies, we are able to type these organisms into A1 to 24 and B1 to 32. So protein 1 is very essential for typing the Neisseria gonorrhoeae organism, and it is present in the trilaminar outer membrane protein. Next is a protein 1 and 3. These two protein helps as a ligand to attach to the host cell. Apart from that, they also have the ability to produce a porins that helps in transfer of the molecule outer or inner to the outer membrane protein. Coming to the another protein that is associated with the trilaminar outer membrane protein, it is a protein 2, and it is the one that is called as a opacity protein, and the strains which contains this protein are called as opacity associated protein strains, because they are able to produce opaque colonies on a media, where the organism having this opacity protein produces opaque colonies, where as the strain which do not have this protein produces transparent colonies. So a single strain with 0 to 3 serological varieties can cause different types of opacity on a single media. And this because of this opacity protein, you can see the attachment of the organism usually appearing in the form of a clumping in the urethral exudate smears. Coming to another important antigenic character, that is the outer membrane, also called as the lipopolysaccharide layer of the endotoxin. So this particular toxin is released during the autolysis, and they can go and induce the infection in the human by activating the inflammatory response. And the toxicity is because of this endotoxin that is causing the infection in the human host. And apart from these lipopolysaccharide endotoxin, the organism also has another toxin which is not very much important to all the strains, but a few of the organism have this protein which is called as the IgA protease, which cleaves the IgA immunoglobulin, which is a secretory immunoglobulin that is mostly involved in the defense mechanism of the host, thereby decreasing the host resistance. Now coming to the resistance of this organism, these are highly delicate organisms similar to that of the Neisseria meningitis. Heat, drying and antiseptics can easily kill the organism, and they are strict parasite of the host. They cannot survive without a host, so they will immediately die when they are in the external environment. So they can die within 1 to 2 hours in exudates that are present outside the body, and in cultures within 3 to 4 days they can be easily killed. So you cannot keep them for a longer period of time on a culture media, and they can survive if they are preserved in a media containing paraffin oil, that is layered with a paraffin oil, or subculture or a slant culture, and stored at 35 degrees centigrade, or they can be preserved at -70 degrees centigrade. Coming to the pathogenicity of the organism, they are the one that are involved in venereal disease, that is a sexually transmitted disease, and it was first described by Gallen in 130 as a flow of seeds. So he described this infection as a flow of seed, and it is transmitted via the sexual contact. And the pathway by which it usually enters into the human host is during the sexual contact. The organism can establish themselves or adheres to the urethral or the mucosal surface via the pili. The adhesion is very rapid. Micturition cannot provide protection once the organism get established onto the urethral surface, and via the intracellular space it can move on to the subepithelial connective tissue within 3 days, and the incubation period is about 2 to 8 days, and the symptoms are different in males and females. In males, it causes acute urethritis where there is mucopurulent discharge containing large amount of gonococcal organism, and the disease can extend to urethra, from the urethra to prostate, epidermis, seminal vessels, and in chronic urethritis stricture formation can be seen, and the organism can also spread to the periurethral space where they cause abscesses and multi-discharging sinuses called as Waterhouse perineum. And women, they are usually seen in the urethra or the cervix uteri, and these organisms are not the one that can easily cause infection in the female, because they have developed resistance because of the presence of stratified squamous epithelium, and because of the acid nature in the uterus, that is around 3 to 5. Because of the acid of the pH in the vagina, the organism will not be able to cause the disease, but in younger females, they are able to cause the diseases called as vulvovaginitis, and the spread of the infection can take place to the Bartholin's glands, endometrium and fallopian tubes, and sterility can take place if the infection spreads to pelvic inflammatory disease and salpingitis. Rarely it causes peritonitis, which is called as a Fish-Hugh-Curtis syndrome. And proctitis can be seen, that is inflammatory response in the rectum or the anus can be seen in both sexes, and direct contagious spread is via the woman. And sometimes conjunctivitis can also take place due to auto-inoculation with the patient's finger by himself or herself. And the organism can enter into the blood, leading to bacteremia from the primary state of infection, leading to arthritis, ulcerative endocarditis, etc. And sometimes it can also cause pyemia, that is pus formation can be seen in different organs. And apart from the venereal disease, the organism is also able to cause non-venereal infection. Mostly in the children, those are born to the mothers who are infected via the vaginal birth. So here it is called as a non-venereal infection, also called as a gonococcal ophthalmia in the newborn. And bacteremia in the newborn can lead to different types of infection of the skin, that is the skin lesions, hemorrhagic pustules or papules involving the hand, forearm, feet and legs, etc., also causing tenosynovitis and suppurative arthritis of the knees, wrist, ankles, etc. And this organism exhibits a characteristic feature, that is a plasmid, which is called as a cryptic plasmid. This cryptic plasmid helps the organism to develop resistance against beta-lactamase antibiotics. So they can be transmissible and can spread the infection to different groups of the organism, and they are able to develop resistance in different groups of organism and hence overcome the antibiotic treatments. Coming to the epidemiology, this organism is strictly a human disease, cannot be seen in the animals but can be induced in the animals, and the source is mostly via the human carriers or the patients, sometimes patients, and the asymptomatic carriage women act as a reservoir host, and they are the one that usually transmit the infection to the male counterparts. And the mode of infection is via the venereal, that is the sexually transmission, and non-venereal in case of infants that are born from the woman who has been suffering from this disease or who is a carrier of this disease. And the non-venereal disease is called as ophthalmia neonatorum. can be treated with the help of 1% silver nitrate solution, which is called as a Creed's method. With the drop of 1% silver nitrate solution are usually introduced onto the eyes of the babies to treat this infection caused by Neisseria gonorrhoeae. Initially, the organism was sensitive to sulfonamide, and hence it was thought that sulfonamides can completely eradicate this or treat this particular disease. But by the usage of this sulfonamide, the organism has become resistant, and it was the reason there was epidemics that were caused due to this resistance in the sulfonamides, and hence change of antibiotics was done using penicillin. And mostly the groups that are affected by this disease is the adolescents and the young children, and the reason for this is a social and cultural reason can be attributed. And due to the prevalence of the AIDS, few time back it was seen that there was a drop in the gonorrheal disease, but nowadays we find it to go parallel with the AIDS. And it is said that the person with the B blood group are more prone to this disease, but the cause of the reason for has not been yet established. Coming to the lab diagnosis, how do we identify this organism? Because it is a venereal disease, it is easy to isolate the organism in the acute stage, but difficult to isolate in the chronic stage. In the chronic stage, it is involving the the whole body or the systemic infection. But in the acute stage, the urethral discharge can be taken as a specimen to identify the organism. And in the women, the cervical swabs, or you can go for the urethral discharge with the help of a speculum. It has to be aseptically collected to isolate the organism in the lab. In male, you can go for the purulent discharge, cleaning the meatus with the help of sterile glaze, and then collecting the specimen with the help of a loop and making the smear and inoculating onto the culture media. But in the chronic infection, where you will not see a purulent discharge, in that case you can go for the morning drop or slightly massaging the protease to release the exudate and collect the exudate to go for the culture or the smear test. Next is you can also go with the centrifugation process, where the deposits of the urine can be taken to identify the organism where there is no exudate that is usually released. There is no purulent exudate that is released. In that case, you can go for the urine specimen. And with the help of the smear, in the gram staining, you can identify the organism. That is a presumptive test. The organisms which are gram negative diplococci are said to be positive for Neisseria gonorrhoeae. That is a presumptive test in male. But in female, it is difficult to isolate because the female vagina will be inhabited with a different group of microorganisms which are the normal flora, and hence there will be a confusion in the diagnosis. So gram staining is only possible as a presumptive test only in the males. After which you can go with the fluorescent more sensitivity testing such as fluorescent antibody technique, where you will detect the antibodies that have been produced against a specific antigen of that particular organism. So these tests are said to be more sensitive and more sophisticated in identifying the organism for the treatment purpose. And for the culture inoculation, you can go for pre-warmed plates. The organisms have to be immediately inoculated with a media containing 5 to 10% carbon dioxide. If the specimen has to be transported, then the specimen have to be collected with the charcoal impregnated swabs, which are then immediately transported to the transport medium, which is a Stuart's medium, till it reaches the main lab, where the final tests are usually carried out. And the selective media for the growth of the organism in acute disease is a chocolate agar or Muller-Hilton agar, and for chronic, because there are no purulent exudates, in that case you can go for Thayer-Martin medium, which is a selective medium to isolate the organism in chronic diseases, and then go for the morphological and biochemical reaction to identify the causative agent. And you can also go for in the chronic cases, you can also go for serological testing, where a complement fixation test was initially used. So within a few days, you will not see the positive reaction, but only after 1 week, you might end up landing with a positive reaction of the complement fixation test, because it did not mostly reliable, you go for other serological techniques such as precipitation, passive agglutination, immunofluorescence, and RIA, that is radioimmunoassay. And when you are going for the serological testing, always keep in mind that you have to go for polyvalent antigen, because the antigenic characteristic of this organism is heterogeneous in nature. You have to select the antigen which is polyvalent in nature to detect the antibodies. Coming to the treatment side of this disease, in 1935, sulfonamides were mostly used to treat the person with gonococcal diseases. So there was sudden decline in the disease that was caused by gonococci, and later on, because of the development of resistance against the sulfonamides, the treatment is shifted to penicillin in 1957. And recently we have found that a specific group of organisms, that is a Neisseria, that is penicillin producing penicillinase producing Neisseria gonorrhoeae, has developed, that is able to bring about resistance against various beta-lactamase antibiotics. So according to the Center for Prevention, you can use certain drugs for the uncomplicated gonorrhea. They are ceftriaxone 125 mg, which is given in a single intramuscular dose, or you can go for ciprofloxacin 500 mg, which is given in a single oral dose. Next addition is with the doxycycline, where 100 mg of the drug is given twice for 7 days to inhibit the infection or to eradicate the infection. Apart from that, you can also go with erythromycin 1 gram, which is given in a single dose. Coming to the prophylaxis, the control of this organism can be done only after the detection. That is, early detection is very important to prevent the person from causing the acute and the chronic diseases. So early detection is the important factor that has to be remembered to control the disease. Next is contact tracing. You have to trace the asymptomatic carriers that usually carries this infection and can transmit to the others. Health education is very essential. That has to be given in schools and the colleges, so that because this disease is more prevalent in adolescents and in young children, they have to be very well educated about these sexually transmitted diseases to prevent the diseases. Next is the clinical disease has no immunity, and hence you cannot go for vaccinations. Apart from the gonococcal diseases, recently we have found a non-gonococcal urethritis, and it was thought that this particular disease is caused by a specific group of gonococci that have changed to L form. But later on it has been established that it is not because of the gonococci, but other organisms such as bacteria, protozoa, that are involved in non-gonococcal urethritis. So they are called as non-gonococcal because no gonococci is involved. And urethritis is just a syndrome of the disease, where the other characteristic feature of the disease is a conjunctivitis and arthritis, that is a Reiter's syndrome. And the organisms that are associated with non-gonococcal urethritis is Chlamydomonas trachomatis, Ureaplasma urolyticum, Mycoplasma horinus. And viruses that are involved are herpes viruses and cytomegaloviruses. Bacteria are Gardnerella vaginalis, Acinetobacter hypophyte. And fungi is the Candida albicans, and the organism protozoa that is related to this is Trichomonas vaginalis. Apart from the organism, the other factors can also induce this urethritis, that includes mechanical or the chemical irritation. Apart from the pathogenic group of organisms, as already discussed, the organisms that are usual, the normal commensals of the human host are the commensal Neisseria, and they are mostly seen in the respiratory tract and the mouth. And the pathogenic significance is that they usually cause infection in the person who where the immunity has come down or lowered immune response is seen. In those patients, this organism can become opportunistic pathogen and cause the infection. So among these group of organisms are Neisseria flavescens, Neisseria catarrhalis, which causes meningitis. And in children who harbors this particular group of organism called as Neisseria lactamia, they produce antibodies against it, and these antibodies protect the children from the gonococcal diseases. That is, the organism is a commensal which is present in the nasopharynx and produces antibodies. It is avirulent and produces antibodies and this antibody protects against the meningococcal or the gonococcal diseases. And the way in which we can discriminate this lactemia and other Neisseria is that this lactemia is positive for ONPG test, that is O nitrophenyl beta D glucopyranosidase. So this is positive in case of Neisseria lactamica, whereas the other usually shows this negative reaction. And Neisseria catarrhalis is now renamed as Moraxella catarrhalis because this organism is showing different symptoms when compared to the Neisseria, and it has got its own properties, and it is the one that is usually involved in the opportunistic pathogenic infections such as laryngitis, bronchopneumonia, meningitis, sinusitis, and middle ear diseases. So this is about Neisseria gonorrhoeae, which is a venereal disease caused by gonorrhea, also called as a gonococcal disease.